Let's bring in Democratic Congressman Adam Smith, the ranking member of the House Armed Services Committee. And Congressman, I want to ask you about these different dynamics involving health care. And let's start, though, first with the boat strikes. You're one of the few members who've seen the full video that some of your colleagues will be seeing for the first time today. How would you describe it? What did you see?
Well, we saw two people clinging to the side of a capsized boat, just the front part of that boat, the bow of the boat. Hard to tell exactly. It's been described about the size of a kitchen table. That's about right, maybe a little longer, a little bigger than that. You can't tell really what's below water. It seems likely that the boat has been split in half at this point, and they're clinging to the side of that boat. They're not armed. They have no communications devices. There's nobody for hundreds of miles around coming to them. So that's what's there, and the reason that Secretary Hegseth doesn't want to release it is because it's very damning. I mean, these two look like they are shipwrecked, and you're not supposed to kill shipwrecked enemy combatants or whatever you want to call them. So they don't want to release the video because they know if the public sees it, it's going to undercut their argument. It also point out Secretary Hegseth, Senator Cotton, some people have said some things that really stretch the truth of what you can see in that video. And if the public sees the video, they will know they weren't being honest. So they don't want to release it.
Well, Secretary Hegseth is saying now the public won't see the full video. And here's his explanation.
In keeping with long-standing Department of War policy, Department of Defense policy, of course, we're not going to release a top secret, full unedited video of that to the general public. HASC and SASC and appropriate committees will see it, but not the general.
What do you make of that answer? I mean, you're saying the American people need to see this video.
Look, Secretary Hegseth is just flat, well, being very dishonest. And he doesn't have much an affinity for the truth. I always like to point out, he's the Secretary of Defense, not the Secretary of War. The law is very clear on that. He can't simply make that up, but he's making this up too. They have released the strikes, what, 15, 20 different strikes of videos? Yes, there is a 5.5-hour tape of this entire operation. If you released all 5.5 hours, there is some sensitive information on that. Now, we all know that Secretary Hegseth is perfectly comfortable with releasing sensitive information, as we saw during the Signalgate scandal, but let's give him that point. What you can do is what they've done over and over again since September 2nd, release the video of the strike. There is nothing classified, nothing sensitive about the roughly 30 seconds where you see the two people on the boat before the strike hits. He is flat out lying to say that that is classified, top secret information that he can't possibly release. And he's really being dishonest when he says, oh, long-standing practice. We would never release this. And yet they've released it, as I keep saying, 15 or 20 times. So he's clearly not being honest with us about the reason for not releasing that video.
Just in this segment, we've been showing video of another strike on that same day on September 2nd. You see the vote, that very first strike that hit the boat before the double tap. Meantime, I want to pivot because I know you're short on time. You have to get to some votes. Let's talk about the other big news we were just talking about with Michael. Republicans revolting against leadership, backing this Democratic health care discharge petition for a vote on the ACA extended subsidies. Are you surprised? Do you expect more Republicans to hop on board?
No, I'm not surprised. There's several layers to this issue. First of all, the biggest part of this is Donald Trump has never had a health care plan. Now, traditionally, in a lot of policies, he makes bold promises that he has no capability of keeping. Like, he's got this perfect health care plan, it's going to be great. In the, 9 years now that he's been a candidate or president, he has never put together a health care plan. The Republicans have never put together a health care plan, and they still don't have one. So that's one. Two is just the simple short-term issue. If we don't do something on these subsidies, people are going to see their health care costs go up, and a lot of people are going to lose their health insurance. But the third issue that people don't want to talk about, look, health care policy is hard. The reason Donald Trump has never come up with a health care policy is because he can't possibly meet his promises. He promises people he's going to give them all the health care they want. It's going to be perfectly affordable. That really doesn't work. Health care policy is very, very difficult. We do not have enough money to cover all of the health care that people want or need. You have to come up with a smart policy, which they have been unwilling to do. But right now, in the short term, let's help people pay for their insurance so we don't have hundreds of thousands or millions of people knocked off of health insurance and millions more see their costs go up exponentially.
So if this discharge petition has the numbers needed to force a vote, how soon could that happen?
Not till January. From the time it ripens, which I think is the moment when we got those 218 signatures, you have to have we don't have to, but 7 legislative days pass before you're required to bring it up for a vote. Mike Johnson plans to send us home on Friday, so we wouldn't get there till early January, even in the House. And then, as your reporter pointed out, passing it in the House is one thing. To get the American people the relief that they need, the Senate would have to pass it and the president would have to sign it. And I want to make one other point on this. Mike Johnson shut down the House for 2 months when he could have been negotiating this. He waited until literally the week before Christmas to finally start talking about an issue of enormous importance to the American people. Republicans refused to negotiate on this issue for months when we could have addressed it. That's what Democrats wanted. That's why we were willing to not vote for their budget and open up the government again. This was so important, we should have addressed it. Mike Johnson and Republicans said, no, it's not even worth talking about until the absolute last minute. And that's why we're in the situation that we're in right now.
We saw Republicans rebuke the speaker on Epstein. Now we're seeing it on health care. Is his speakership in jeopardy? What is the vibe, and what are you hearing behind the scenes?
Well, absolutely, his speakership's in jeopardy. He's clearly lost control of his caucus. But who would they replace him with? Who would be able to control that caucus? Look, I think the most important thing is the entire Republican caucus needs to be held responsible for all of the horrific stuff they've done this year, and that's about next year's election. You know, Democrats need to work hard to present a reasonable alternative to the chaos and dysfunction that Mike Johnson has offered, but we have a massive opening to do that because Republicans have failed over and over again to address the issues. You know, from President Trump through House Republican caucus, we're seeing unemployment going up, inflation going up. You know, the tariffs aren't working. The reconciliation bill isn't working. We are in a series of crises right now that Democrats have an opportunity to step up and address, and that's what I'm going to be working hard to make sure that we do.
Congressman Adam Smith, thank you very much for your time. We appreciate the conversation.